Good evening. I'm Dr. Reiner, your host of the Independent Doctors of Pahrump. Tonight is, of course, a Monday night, and it is the Monday before Christmas. So I want this opportunity to wish you and yours a very happy and Merry Christmas and a Happy New Year. I will be out of town following next week, so there will not be a live show. So you will have to bear with a rerun segment. And with that being said, we might have an abbreviated show tonight, depending on if we have callers in tonight. May do a live 30-minute section, and then we might have a rerun after that. And with the year coming to a close, I want everybody to maybe take stock of what you've done in the past year with regards to your health, and maybe make a few promises to yourself going into 2016 that you will, try and modify your diet, try and modify your activity level if your health permits. Try and get a little more exercise, try and do a little walking, try and do something to improve the overall state of your health, and that would be a good thing. The road of 1,000 miles starts with one step in front of the other, and no journey is easy, but persistence usually does pay results, and I know that because I've seen it over and over and over again. So one of the topics that keeps coming up in the office again is blood pressure and what's normal and what's not normal. And I've had this discussion with numerous patients, and I want to try and tell you what is a normal blood pressure. And obviously we have these so-called numbers that everybody has heard is 120/80. And this is so-called the normal, standard. Well, with every standard, there are deviations across and onto the other side. That being said, really what is important is the difference between the top number and the bottom number. It's a simple math problem. 120/80 equals 40. 40 millimeters of pulse pressure. And as I've described before, pulse pressure is the actual force or the head of pressure driving the blood through your arterial system. And it says a lot about the dynamics of your arterial system when you divide or subtract those two numbers. Meaning that if your blood pressure is 150/100, that is basically 50 millimeters of pulse pressure, which is really no different than 140/90. It just sounds better. 140/90 sounds better than 150/100, but the difference between the two numbers is exactly the same. And where would we draw the line with that difference in pulse pressure? For the most part, 60 millimeters of pulse pressure might, when you start to get over that number, might start to be an issue with your pressure. Greater than 60, and certainly north of 80 is really an issue as far as I'm concerned. But as we are young, our blood vessels are extremely compliant, and what that means is they can stretch. So we have this, if our blood volume increases, our blood vessels can stretch to accommodate that change in volume. And when they do that, we see very few changes in the blood pressure number, meaning it can be 100/60, it could be 110 whatever. But basically, the blood pressure is always very normal in that range, and that's because our blood vessels stretch. So that's why when you're young, and I say young, under the age of 40, we look at the bottom number. The bottom number is only important in the youth. So if that number is in the 90s or higher, then that is truly a stiffness in your blood vessels, and then that may be an issue. So if you're young and you have a number, the bottom number greater than 90, then that becomes a blood pressure that you need to be concerned about. And again, see your provider. But once you get over the age of 40, your blood vessels start to stiffen up, and their ability to handle the extra volume or the changes in our volume become somewhat limited, meaning they don't stretch as much. And when they don't stretch as much, we basically have a change in the ability, or we have a change in the diameter of the blood pressure. So let's say that for the purposes of the argument or the discussion, that this is the size of a blood vessel, and you increase your volume and it goes up twice as big. So you've now taken a lot of fluids, and your temporary volume is twice what it normally is, and your blood vessels stretch to accumulate twice the volume. If that was true, then your blood pressure won't change, because there's no change. We can accommodate the same volume over time, meaning imagine there's a hose and you're pumping water through the hose. The volume doesn't change because the diameter of the vessel has changed. Now, let's suppose in that same argument, now we have stiff blood vessels, and we increase the volume again by 2. So we double our volume over that same time. Well, what happens, and your vessels cannot dilate, they cannot increase or change in size to accommodate that volume. That would be what I would say is a relative decrease in the diameter of the blood vessel times 2, meaning it should go twice as much, but it doesn't, and you've increased the volume twice as much. And so therefore the vessel has not changed, so therefore the diameter, the relative radius or the relative diameter decreased by 2. Now, there is a physics formula which basically, I don't want to bore you to death, but it says volume equals, or velocity equals, the 1 over the cube of the diameter. So it's an inverse relationship. You decrease the diameter by 2, and your velocity has to increase 2 to the 3rd power 8 times. 2 times 2 is 4, times 2 is 8. So with that being said, you can see that as we get older, our blood vessels change in their diameter, meaning they go, we see this divergence in the velocity of our blood, or our blood pressure, meaning most of the elderly who suffer from blood pressure suffer from a blood pressure condition called isolated systolic hypertension, meaning the top number is the number that grows inside. So with that mathematical formula that we talked about, it would not be uncommon for someone who had a low blood pressure, let's suppose stiff blood vessels, they were running 140 over 90, and you increase the volume, and now they had to increase the pressure to accommodate that, they might double their pulse pressure to 180 over 90. And that would be a substantial increase, because now you basically have to increase the pressure really substantially to get the same volume through a stiffer hose or a stiffer blood vessel. So that is basically what I define as what we need to, when we need to examine your blood pressure. And if you're checking your blood pressure, make sure you bring your home blood pressure cuff into your doctor's office to have it checked against the gold standard, which is what's on the wall. Never expect the same number when you check blood pressure. It does not do that. It is a very dynamic process. And so it changes from time to time. And the more you check your blood pressure, the more it will change. It spasms the artery, and you get unreliable numbers. So make sure that when you are checking your blood pressure, that you give it time for the blood vessel to relax after you do that. And let's see, when you come back, we're going to talk a little bit about placement of the cuff. We're going to go on a break. Thank you for tuning in. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, And I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.